First, we would like to introduce you to our special guest this evening. We have Dr. Philly Fentides, who will be answering questions. He is Urgent Care Medical Director for the Sharp-Reed-Steely Group. And we have County Supervisor Nathan Fletcher. Welcome to both of you, and thank you for joining us tonight.
Yeah, starting us off will be Supervisor Nathan Fletcher. We want to thank you for making time. We know you've been very busy with your daily updates. Appreciate it greatly. We're getting a lot of questions, you can imagine, some specifically about the stimulus payment. People want to know, they've heard that they have to pay the stimulus money back on next year's taxes. Is that a question you can help us out with?
Yeah, that's definitely a federal issue, but you don't have to pay the stimulus back. The stimulus funds are designed to help folks get through this period of difficulty, get through this period of uncertainty, help prop up an economy that we know is suffering. And so there's no part of the stimulus payments that if individuals receive that they won't have any obligation to pay that money back.
All right, that's just a point of confusion for some people. The big question that I get the most from people is, so what's next? What's happening next? What is the strategy going to be for moving forward? The governor spoke about a framework for easing stay-at-home restrictions. Right. Can you talk about that for our viewers who may have missed that?
Yeah, I think what's really important to keep in mind as we think about this is the notion of going back to normal. In order to be able to go back to normal, we would have to have herd immunity, which means that the overwhelming majority of folks are immune from catching it. And the reality is we are unlikely to get to a point of herd immunity short of a vaccine, which is going to take some time. And so I think it's important that we all really think about how do we begin to get back to a new normal, or how do we begin to turn the dial a little bit. If you think about, as we went into this, we started with the public health order, we started with guidance, we banned mass gatherings of 250, and we gradually turned that dial. What we're likely to see when we come out of this is a gradual unturning of the dial, a pause to see what the impact is. You know, Singapore was widely praised for their incredible early response. They undid things too fast, and now their cases are skyrocketing, and they're having to ratchet back down. We want to try and avoid that. What we want to try and do is slowly come out of this, and we're not there yet, but we're preparing. Slowly come out of this in a way that preserves the integrity of the healthcare system. But as the governor alluded to, you are unlikely to see 45,000 people in Petco Park watching a baseball game or at a concert anytime this year. We're likely to come out of this into a new normal that begins to get back a little bit back to normal. But the reality is that the nature of coronavirus, the lack of a vaccine, the lack of a medical treatment, means that we're going to be in some state of responding to this for a while. It doesn't mean things won't get better. It just means we have to reset our expectations a little bit, understanding the nature. What the governor outlined were kind of 6 key thresholds that we have to meet in order to begin to come out of it. The availability of not only mass testing, but the ability to trace and isolate anyone who's positive, specific plans for the vulnerable, reimagining businesses and schools and what that will look like, and a series of other steps that we have to do. And we are working every single day to answer those 6 areas, to develop plans, to assess our infrastructure, and to be in a position once we think it is appropriate to begin to take those initial steps.
Up one of those components which is critical, and there's a lot of controversy about. We had a pop-up testing station go up in Maricosta that is being shut down by the county now. People want to know, when will they be able to get tested for themselves? When will there be widespread testing to find out if people are asymptomatic or whether they've had it already?
Well, and I wish I could tell you. One of the most frustrating things of going through this is there's just so many things that we just don't know. And I think we've tried to be very transparent with the public from a public health standpoint about, look, this is what we know and this is what we don't know. We know that we are seeing an increase in testing. We're seeing an increase in testing in both the PCR, the kind of test that we're used to seeing, and we're seeing progress being made on the more serology-based testing that can do in a different way. But the reality is you have an entire planet that is all fighting for the same limited capacity of testing. And while you have a lot of labs and a lot of commercial resources and folks ramping up that capacity, we have to continue to fight. A few weeks ago, there was a story out that San Diego County was doing better than most other counties in terms of testing per 10,000 residents. We want that to continue, but it's really important that if you get a test, you have to feel confident that it is a good test, that it is has been evaluated, it has been approved, and we have to be really mindful in these difficult periods of individuals popping up, maybe taking advantage of the situation, who are not properly trained or verified in order to do it. And so we're fighting every day to get more testing. We're beginning to see increases, and we're beginning to see on the horizon some significant increases in the availability of testing, but we've got to just be patient as we get out there and fight for more, and we're going to continue to do everything we can to get every valid and viable test deployed in San Diego County, but it's got to be valid and viable.
Yeah, huge logistic hurdles to getting to that. Supervisor Fletcher, we're going to check back with you in a little bit later in our newscast, so don't go anywhere. We're going to welcome back Supervisor Nathan Fletcher. A few more questions. This one, Nathan, somebody tells us, I walked past a San Diego fire station and saw 3 firemen in uniform working within 2 to 4 feet of one another on an emergency vehicle in the driveway. None of them were wearing masks. Aren't they supposed to be wearing masks?
Yeah, thank you for the question. There is at times kind of uncertainty. We know that there's been a lot of orders. There is a lot to digest. Our public health orders are a strong encouragement for everyone when they leave their home, whether they're going to an essential job or they're going to an essential service. It is an encouragement that they wear a mask, but it is just that, as an encouragement. It is not a requirement. We do have a handful of categories of entities where it is required that the employees wear a mask. These are things like grocery stores, banks, convenience stores, pharmacies, gas stations. There are a handful of others, transit centers, transit operators, where the employees are required to wear a mask, but that is not a requirement for our first responders. It is an encouragement, and we encourage them to do it when they can. In terms of the physical distancing, we strongly encourage that in essential businesses, but the reality is there are some essential businesses that just as a matter of practice cannot always maintain 6 feet physical separation. If you're in a hospital and your doctor is operating on you, of course it's impractical for the doctor to be 6 feet away. If you're a firefighter and you're responding to a call and you have your fellow firefighter right there beside you and you're working on an issue, it may not be practical for them to achieve that. And so, again, the face coverings are a strong recommendation for everyone when you leave your home. And for those 7 business entities, some of which I listed off, it is a requirement for the employees. And again, the face covering primarily serves the role of you may be positive and not know, and that can help stop you from spreading it. So it's protecting others, provides some protection from you gaining it, but primarily it's to protect you from other folks.
All right, hence Chairperson Cox's, if you leave your place, cover your face. We'll check back with you.
Cover your face.
Yeah, yep, right. There you go. We'll check back with you in a few. County Supervisor Nathan Fletcher for our next question. Viewers seen footage of streets being disinfected or sprayed in other countries and wonders why we're not doing that here in San Diego. Supervisor.
Thank you for the question. We're looking at every option for everything we can do to respond to this, both from personal hygiene, from hygiene of buildings, certainly to hygienes of our streets and other things. The County Department of Environmental Health outlines the procedures that jurisdictions can follow and should follow as it relates to disinfecting surfaces. And I think we've seen our Department of Environmental Health really respond creatively, looking for everything that we might do to protect the public, and we'll continue to look for those opportunities and look for more things that we need to do in order to best protect the public. But again, to reiterate, the best thing you can do to protect yourself are the things that we've been outlined, the things that Dr. Fletcher's talked about. It is that stay home. If you have to leave, ensure physical distancing. And, you know, just to follow up, Dr. Fletcher's made a great point that there's any number of surfaces where coronavirus may live, and if your hand touches it and it's there, then you may come in contact with it. But as long as you don't touch your mouth, your eyes, or your nose before you wash your hands for 20 seconds, you will be okay. And so we'll keep looking for every opportunity to disinfect everything we can. But the most important thing is a decision each and every one of us make about disinfecting our own hands and coming up with your own routine and your own song or poem or whatever it is you do to get to that 20-second threshold.
And you've brought that message home many times, that along with the assumption that your neighbors, everyone around you, assume all of them have the virus and are carrying it. If you want to keep yourself safe, behave as such, correct?
Exactly right. And if you go in that mindset, and you can still be friendly to folks from 6 feet away, you can still wave at folks and still say hello, but it is really adopting that mindset. And, you know, something that is really incredible is so often we give public health advice about what folks should do to improve their own public health, and you know, sometimes we get adherence to those and sometimes we don't. But in this instance, we've seen San Diegans respond across the board. People have made tremendous sacrifice. They've made a tremendous commitment, and they've made a commitment because their actions impact others. You know, as we each choose to adhere to these guidance, and as we choose in our family units to do the same, it's not just your own life you're saving, it's the life of someone else. And so it's been really encouraging to see our community come together. One of the reasons that San Diego has had so much initial success in flattening the curve, and I want to caution that by saying initial success, because the coronavirus is just as contagious tomorrow as it was a month ago, and so we can't lessen our posture today, but we've seen so much initial success because San Diegans have truly bought in out of a desire to help one another. Yeah. And it's really struck me that in San Diego, the coronavirus is not the only thing that is contagious. A spirit of community, a spirit of compassion, a spirit of looking out for one another, a spirit of reaching out to each other during this difficult time. And it is very, very difficult for so many folks. That is contagious, and that's what's going to really help us get through this together. All right. As we like to say around here, we're in this together. Supervisor Fletcher, we'll be back in a few with you.
Thanks, Beverly and Carlo. A lot of people are chiming in, so we thank our viewers for that. Supervisor Fletcher, Kathy Carrico asks, question for Supervisor Fletcher. If we encounter a homeless person, who should we contact?
Yeah, thank you for that question. We have, in some ways, struggled a little bit when it comes to the challenge of homelessness. We had a homeless challenge, an affordable housing challenge, crisis, you might say, before we put a global pandemic on top of that. And dealing with the global pandemic has not made the challenge of homelessness any easier. We have moved rapidly to get public health nurses with homeless outreach teams looking for symptoms to have public health motel rooms available for those who need it, hundreds of rooms for the Regional Task Force on Homeless to put individuals in, and then, of course, the incredible work and effort of the convention center. If you encounter someone on the street, the best advice that we can give you and the best recommendation we can make is to have them contact any of the homeless service providers who are out there. In each region of the county, there's a number of different ones who are there, and they are best positioned to help get that individual into a sheltering environment. We think that there's tremendous potential. The convention center initially was there to provide physical distancing for our existing shelters, but they are now beginning to take folks who are unsheltered into the convention center to get options, and there's an array of other options. And so the Regional Task Force on the Homeless has really been the coordinating entity for that effort. Our focus at the county has been protecting the public health. To date, we're fortunate. We've only had 14 unsheltered individuals test positive. Each of those individuals is getting care either at a county public health motel room, which includes the food and the laundry and the sanitation, along with daily wellness checks. A couple have been in the hospital, and they will go to our public health rooms when they come out. But the coronavirus attacks particularly hard our vulnerable populations, our seniors, folks with respiratory illness, obviously folks who have inequities in broader health care coverage, and that definitely includes the homeless. And so we've really tried to do a lot to address that. But I think the issue of homelessness is one that transcends and is even bigger than coronavirus. And frankly, we have to do a better job. And we have to provide more services, and we have to provide more options and provide more help. And it would be my hope that we can continue to do that.
All right, thank you so much, Supervisor Fletcher. Again, lots of questions coming in. If we don't get to them during this special hour, we will monitor this page and try to answer those questions in the upcoming days on News 8. But for now, we'll send it back to you guys in the studio.